More than 250 residents in Spartanburg County, South Carolina are in quarantine due to a major measles outbreak. The state's Department of Health confirming 111 active cases. This marks the second U.S. measles surge this year with 1,912 cases so far, a more than 14,000% increase from 2020. Fox News medical contributor Dr. Nicole Saphier joins us now with the latest. Good morning to you, Dr. Saphier.
Good morning, Ainsley.
Good morning. What is causing all of this? This is where I was born, in Spartanburg. This is very concerning.
Absolutely. Lots of evidence of community spread of measles, not just on the East Coast, but throughout the country as well. We're seeing rising numbers. As you have mentioned, hundreds of kids and people who have been infected, even more in quarantine. And to be honest, this is somewhat expected as we see declining vaccination rates. The United States is in jeopardy of losing the elimination status of measles for the first time since 2000, once it was declared. Canada just lost their elimination status this year, and they have vaccination rates of about 82%, much lower than the United States. But the reality is, Ainsley, we have seen our MMR vaccine rates go from 95 to 92% in just the last 5 to 6 years. When I said during COVID that the Biden administration's CDC was the biggest single risk factor for vaccine hesitancy in the United States, I was not mincing words. And because of the mishandling of COVID, we started to see even a bigger decline in vaccination rates. Unfortunately, the way things are going right now with the CDC and the current vaccination advisory committees, we're seeing even more mistrust and confusion. And so I expect that we're going to see further declines in vaccination rates, and we're going to see more measles cases. Lots of cases in Canada, lots of cases in measles, and we're in the middle. Usually we are protected by high vaccination rates, but as they decline, we will see more community transmission here in the United States.
Okay, Dr. Saphier, the Senate failed to advance measures for the health care plan. They expire on the end of the year, December 31st, and we're going to see prices go up on insurance if this is not fixed. What's your reaction to that, and what do you think is the best plan?
So the Senate rejected both the Democratic and the Republican plans that were put forth for the health care. And to be honest, that was the right move, because whether you're looking at the Democratic Medicare for All or the skinny piecemeal GOP plan that was presented, neither are going to work unless you focus on fixing the fundamental damage caused by the ACA. What the Affordable Care Act did was they took away power from the physicians and the patients. They gave it to the hospitals and the insurers. This led to consolidation, increased prices, decreased quality, and a third last year of Americans either delayed or didn't get medical care because of cost. That is not affordability or access, that is failure. And you don't fix healthcare by doubling down on what failed. The only way forward is true, meaningful reform. And what that will mean is you have to expand some of those subsidies, even if it is for the short term, just to give some short-term fix for the people. You want to have aggressive fraud enforcement, expand the HSA, allow physicians back to own hospitals, to bring that market pricing, because they took away the free market in healthcare, increase price transparency, remove a lot of the prior authorizations, and make sure that hospitals have out-of-network coverage. In my opinion, Senator Marshall's plan is the most comprehensive healthcare reform plan we have. Not only does it have short-term relief for the American people, but is the only one that, in my opinion, has the teeth to really have long-term success. I hope Cassidy and Marshall work together. Very smart physician politicians. They understand, they get it. We need to bring free market back to healthcare to do what's right for the American people. We do not want them to suffer from these high rates that are about to set. So we have to make sure that we give them short-term relief, but we also need that long-term plan in place to really peel back all the damage that the Affordable Care Act has caused.
Dr. Saphier, great to see you. Thank you so much for coming on.
Virus that's going around right now is so strange, the symptoms. I started off with a somewhat of like a sore throat, like that literally felt like I was like swallowing knives, and then that went away, and then I had like nasal drip and super stuffy nose, and like a lot of sinus pressure. Now that kind of went away, and now I have like my head is super, I have like a headache, no fever though, like the whole time no fever. I had super bad body aches like throughout my entire body, and it's not a flu, it's not COVID. What else? I think that's it. The body aches was really strange. Like, for one day, every time I'd lift up something, like, I felt like it was super painful because I had, like, no energy through my muscles. I've been taking so much medicine. What else? Oh, night, like, sweats. It's awful. Like,
A lot of people are saying that it's this new virus that's basically going around, and that some people are describing it similar to the vid. Other people are describing it worse than the pandemic. Some people are saying that they actually went and went to the doctor. It's not the flu. And they also took the vid test, and it's not that either, but it is spreading rapidly. I actually was doing a live stream, and I was talking about this on the Millionaire Morning Show, and it was several different people that were saying that they were sick over the weekend, and that this thing is actually going around even in the city and in multiple different places throughout the United States of America. I haven't heard anything from the mainstream media or the news about it, but there's this super virus that is basically infecting and affecting people, and it is keeping them like on the toilet, throwing up, with diarrhea, body aches and pains. Some of the similar symptoms that you've seen from the vid, but they're saying that they're lasting longer, that is worse, but that it's not identified as the vid. And I remember back in 2019, not saying that this is what it is or that it's a pandemic, I remember that everything had shut down. And I was explaining to the people on the Millionaire Morning Show that we don't even talk about what happened during the pandemic anymore. It's almost as though people forgot about it, or it never happened, or it just wasn't a big deal. And I don't know why we just swept it under the rug like it didn't happen, but we act like it didn't happen. And now it's a lot of people that are talking about this. And this is one of the benefits of social media, because you actually get to get informed from people that are sending me these type of videos inside of my email, so that I can keep you guys informed on how to keep yourself safe and not fall into this situation.